This is Narasamma, an impoverished villager. Her husband, a chronic drinker, was informed about her wife's pains, but he did not take it seriously. She was helpless and didn't know what to do. Her husband didn't even bother to take her to the doctor. Narasamma suffered a lot and finally she had a miscarriage. Like Narasamma, there are many stories. The Indian countryside, especially the rural and tribal areas, are the most affected due to lack of or delayed medical assistance. India has signed up to achieve Sustainable Development Goals by 2030, and Piramal Swasthya is fully geared to bring in transformation through operational excellence, which will ultimately improve delivery of primary health care to the last strata of our multi-dimensional society.
నమస్కారం, నా పేరు డాక్టర్ చైతన్య. నేను ఈ మొబైల్ మెడికల్ యూనిట్లో పనిచేస్తున్న డాక్టర్ని. వీరు నా సిబ్బంది. ఆయన మా పైలట్, మా ఏఎన్ఎం, మా ల్యాబొరేటరీ టెక్నీషియన్ అండ్ మా ఫార్మసిస్ట్. మేమందరం మారుమూల గ్రామాలకు వెళ్ళి వైద్య సాయం అందిస్తాం. మేము ఎలాంటి చికిత్స అయినా సరే ప్రథమ చికిత్స అవసరమైనట్లకి ఇస్తాం. ఉదాహరణకు మధుమేహ సమస్యలు కావచ్చు, గుండె సంబంధించిన వ్యాధులు కావచ్చు, స్త్రీల ఋతు సమస్యలు కావచ్చు, గర్భిణీ స్త్రీకి అవసరమైన వైద్య సేవలు మొత్తం వారి ఇంటి వద్దకే వచ్చి మేము అందించడం జరుగుతుంది. మా పట్ల వాళ్ళు చూపే ప్రేమ కూడా అమోఘం. ఇక్కడ కనీసం రవాణా సదుపాయం కూడా ఉండదు. అలాంటి చోట్లకి మేము వెళ్ళి వాళ్ళ కష్టం తెలుసుకుని వాళ్ళకి వైద్య సాయం అందిస్తుంటే వాళ్ళ కంట్లో చూంచే ఆనందం అంతా ఎంత కాదు. నేను డాక్టర్ చదివిన దానికి దీనికి తగిన ప్రతిఫలం దొరికిందని ఎప్పుడూ ఆశిస్తున్నాను.
Narasamma's husband learnt a lesson and this time took better care of her pregnant wife with the help of regular checkups at the medical camps in his village, which paid off. Narasamma's second baby survived as she gave birth to a healthy baby at the nearest hospital. Through this kind of community outreach program, Piramal Swasthya also works to sensitize at-risk patients about the threat of diseases like cancer and tuberculosis if one does not quit drinking and smoking. Narasamma's husband was also sensitized, who quit smoking and drinking and now takes good care of his family. Piramal Swasthya is an important link in bridging this last mile gap in delivery of primary healthcare services to the needy. The main objective of this community outreach program is to render continuous healthcare services at the doorstep of rural underserved population. Some medical issues can become fatal if not treated in time. In a remote village, Saddam fell down during work due to unknown reasons. Her wife was informed by a passing villager. She was helpless and didn't know what to do. In the rare of rarest case, Piramal Swasthya's mobile medical unit team's doctor helped her and identified that Saddam suffered a mild heart attack and gave him primary healthcare treatment. Piramal Swasthya's community outreach program aims at tackling barriers faced by rural people in accessing primary health care.
ఇంకా మా ఎంఎంయు మా తోటి స్టాఫ్ చాలా నిబద్ధతతో కూడింది. ఎక్కడ పనిలో అలసత్వం ఉండదు. ఎంత లేట్ అయినా సరే వాళ్ళు మొత్తం ప్రజలందరికీ వైద్య సేవలు అందించిన తర్వాత అక్కడి నుంచి వెళ్తారు. ఆఖరికి ఇంటికాడ ఎక్కడెక్కడో ఉండి వస్తారు. వాళ్ళ ఇంటికాడ భార్య బిడ్డలు ఉన్నా ఏదన్నా పట్టించుకోకుండా ఇక్కడ కనీసం ఫోన్ సిగ్నల్ కూడా దొరకదు. ఆహార విషయాల్లో చాలా అజాగ్రత్త కూడా పాటించారు. ఇక్కడ ఏమీ దొరకని స్థితి అయినా సరే ఉదయాన్నే వచ్చి వైద్య సాయం అందరికీ అందేలా చూస్తారు. నాకు ఇక్కడ పనిచేయడం ఎంతో ఆనందంగా ఉంది. నమస్కారం.
As a part of this, fixed-day mobile medical vans with doctors and paramedic team visit a community or village at regular frequency. There, they conduct diagnostic and lab tests, and test reports are updated in the electronic health record in real time. Each beneficiary is provided a unique identification number, and an electronic health record is created. This immensely helps in clinical management of diseases and conditions. The community outreach program operates with two models, the doctor-led model and the nurse-led model, depending on the demographics of the area being covered. Other initiatives and medical interventions have resulted in significant social and behavioral change among the rural and tribal poor, which has led to a demand generation for availing mobile medical unit services in order to prevent risk of mortality caused by other high-risk diseases like diabetes and hypertension. Piramal Swasthya's community-based cancer screening program is first of its kind initiative to address oral, breast, and cervical cancer's burden in northeastern states. The aim of this program is to detect cancer in the early stages and then handhold the patient through a complete diagnosis and appropriate treatment through sustained partnerships, thus creating an opportunity for the beneficiaries to survive. In India, truck drivers have to cover long distances and are prone to a multitude of health risks that are often neglected. To address the health needs of this community, Piramal Swasthya has joined hands with STFC to conduct screening, diagnosis, treatment, and referral for non-communicable diseases like diabetes and hypertension, communicable diseases, and minor ailments. Change cannot be brought about alone, and Piramal Swasthya believes that there is a need to join hands with all relevant stakeholders. Our partnerships have been built to share deeper understanding on issues that affect people's well-being. Continuous support from our institutional donors and CSR partners ensure scalability and stability, thereby allowing sustainable change. In the pursuit of bringing health to millions of lives over the years, we have evolved from one state to 20 states, from statewide project to nationwide scale, from traditional systems to technologies, and from implementers to partners. We value Seva Bhav, which is ingrained into our DNA. We focus on the significance of our solutions, their delivery and uptake by the beneficiaries.